Hi everyone, thank you for joining us here at Jennifer Bella TV, and I'm sitting with Dr. Ross at Genesis Infertility Clinic. So Dr. Ross, could you start by explaining to us what exactly infertility is, and is it more common than you would think?
Yes, so infertility we define based as failure to conceive after 12 months of trying in women who are 35 or under 35, and for women 35 and older after 6 months of trying. And it is quite common. About 80% of couples will conceive in their first year of trying, but there's a whole fifth of patients that don't conceive in that first year. So it is fairly common.
Okay, and why is age so important for a woman who is trying to have a child, and is it more difficult to conceive as a woman gets older?
Yes, so the peak fertility for women is actually in their 20s. We're born with a finite number of eggs, and sadly that number declines as we get older. The rate of decline accelerates at age 35, and so we see a lot of women who are 35 and older who have more trouble conceiving.
Okay, so you would say 35 is probably the age that women should maybe start to look out for a decrease in fertility.
Definitely. It even starts declining from 25 onwards.
Wow.
But if you are interested in having a child and you have a partner, then generally we recommend getting started in your 30s or 35.
Okay. So what are some of the procedures and treatments that you offer here at the clinic that can help these women that are trying to conceive and having issues?
So part of the issue is that when the egg count declines, so does the quality. Okay. And so a lot of the eggs, even though you may be releasing an egg every month, may not be a normal egg. So part of our treatment is to help women produce more than one egg each month with the hopes that they will release a normal egg. This does slightly increase the risk for twins, and so that is always part of our counseling, is that with any sort of fertility treatment, you may be at an increased risk for twins, although many of our patients are not upset by that news.
Yeah. That's great. So what are some of, as a woman, what are some of the signs maybe that we can look out for to start considering, seeking fertility treatment?
Sure. So it's difficult because some women may not have any knowledge that their fertility may be declining. I often ask patients to query their mom about how old they were when they had them and how old they were when they went through menopause, and is there any family background of issues conceiving. We also look for anatomical issues that might cause problems. So women who have any history of fibroids or endometriosis, we generally recommend that they see a specialist sooner rather than later. So it's something that I encourage most women to address with their regular gynecologist if they're thinking of trying to start having a baby. And oftentimes the gynecologist, if they think there are any red flags, will refer them to see us sooner rather than later.
Okay. So is infertility something that you would say is age specific, or do you get a younger generation of patients in here that maybe are in the prime age to conceive but are also having difficulties?
Definitely. So even though we know fertility declines as a woman gets older, there's a large cohort of patients we see who are in their 20s, and we do encourage women, if they're having trouble and it's been a year or more, if they're in their 20s, they should definitely seek help rather than just continuing to try and feeling frustrated. It becomes very emotionally and physically frustrating for patients when it's been a year or more of trying and they haven't gotten pregnant, and their parents may be saying, "Oh, don't worry, it's going to happen, you're going to be fine, you're so young," but oftentimes these patients do need some help.
Right.
So I do recommend they reach out.
And would this also be a good option for same-sex couples that are trying to conceive and want to have children on their own?
Yes, so we have patients who are either single desiring parenthood or same-sex couples who are desiring parenthood to come and see us, and we counsel them about the options available, using sperm donors, using egg donors, and how they can go about conceiving even in that scenario.
That's great. So for women out there that are watching and wondering, maybe they don't have a partner at the moment, but they're worried about, eventually conceiving or maybe having a child on their own, do you offer options for them as well?
Sure. So we recommend egg freezing for patients who are interested in having a child in the future but may not be partnered. Generally, the best time to pursue that is before age 38. So if you're 25, I wouldn't worry. But maybe if you're entering your 30s and still thinking about it, at least come for a consultation, see where your egg count is at, and decide if it's the right thing for you.
And do you want to talk a little bit about what that process is like?
Sure. So the process for freezing one's eggs is fairly similar to going through an IVF process. So you're on hormonal injections for about 10 days and coming in to have blood work and sonogram to see how your eggs are growing. And then we retrieve the eggs with patients under a nice sedation, and we freeze them in the lab, and they can stay frozen indefinitely until a patient is ready to use them if she needs them in the future. But it is fairly generally an initial consultation and then starting the process, and the process is 2 weeks or less.
That's great. Very helpful for all different types of women. So I'm sure we have a few male viewers out there that are also wondering, is this a problem that can also affect men?
Yes, so actually about 30% of infertility is related to what we call male factor. So there are a number of reasons why a man's sperm count can be low. But I always do recommend when a couple first comes to see me that we do both the female evaluation and the male evaluation concurrently.
Okay. Well, thank you, Dr. Ross, for sharing such an important and sometimes sensitive issue that women face every day. And everyone, be sure to stay tuned every Sunday for Ask the Doctor on Bella TV for more information from all of our doctors.
Thank you.